Hello, I would like to introduce myself. I'm William Records, and I'm proud to be the LGBTQ Veteran Care Coordinator at the historic Dayton VA Medical Center. LGBTQ VCC serves as the point of contact for veterans who identify as members of the LGBTQ community, to include allies or someone just wanting more information about the community. For example, if you have a family member who recently informed you of their affiliation with the LGBTQ+ community and you want more guidance, a safe space to talk, or explore how to cope with your own thoughts and feelings, please contact your local Veteran Care Coordinator. LGBTQ+ VCCs provide a safe space for veterans to discuss presenting challenges related to sexual and gender identities and collaborate with other providers to ensure the most quality care is received. We encourage each of you to enroll in healthcare at the Dayton VA. LGBTQ+ VCCs also engage in community outreach projects to support veterans in the community. They also help veterans to obtain prosthetics. They help veterans navigate the healthcare system. They also provide community resources, work with endocrinology to explore options for potential hormone therapy, ensure that proper steps are followed with the documentation needed to change names and/or gender status markers. The LGBTQ+ program here at the Dayton VA strives to align with professional and national LGBTQ+ guidelines to create a welcoming environment for our veterans, promote staff sensitivity and training, use respectful and inclusive language, assess sexual orientation identity and gender identity, and sexual health and appropriate follow-up care. Become knowledgeable about the LGBTQ+ health disparities, assess for social stressors and resilience factors, assess for exposure and violence including intimate partner violence, provide individually tailored person-centered care. Specifically, the VA employs 3 strategic approaches to address LGBTQ+ health disparities. They develop national policies such as non-discrimination and healthcare policies. They educate staff and promote assessment, inform and engage LGBTQ+ veterans, for example, with the VCCs at every VA. They also provide a welcoming environment, signage, posters, and fact sheets posted throughout the facility. Now I'll turn the rest of the presentation over to our mental health clinic psychologist, Dr. Belinda Chaffins.
Thanks, Dr. Records. I'm Dr. Chaffins, a clinical psychologist and certified sex therapist specializing in working with the LGBTQ+ community at the Dayton VA. Now let's talk about services for LGBTQ+ veterans. All veterans are welcome at the VA, including those who identify as LGBTQ+. LGBTQ refers to lesbian, gay, bisexual, transgender, and queer identities. The plus sign captures identities beyond LGBTQ, including pansexual, asexual, agender, gender diverse, non-binary, gender neutral, and queer. Veterans with sexual and/or gender minority identities have faced stigma and discrimination, which can affect health. As a healthcare institution, VA works to make sure that LGBTQ+ veterans know that they are welcome and are trained to meet their healthcare needs. As a result of stigma, stress, and discrimination, LGBTQ+ veterans face increased health risks and unique challenges in healthcare. We want you to feel comfortable talking with your VA providers about all aspects of your life, so we can offer the best care possible. Coming out to your healthcare provider is an important step in maintaining your health. To see you receive the best care possible, your health provider needs to know who you are. Information about your sexual orientation and gender identity will prompt your provider to ask specific questions about potential risks to your health and provide appropriate health screens. If you do not feel comfortable opening up to your provider about your sexual orientation or gender identity, ask for another VA provider. It is important for you to be able to trust your healthcare provider. Tell your provider about the medicines you are taking, including herbal remedies and over-the-counter medications, and the surgeries you have had. Information about your full health history will enable your provider to determine the best treatment for you. We want to reassure you that the conversations and information you share with your VA provider are confidential. You can ask that this information not be entered in your medical record. However, medically necessary information such as diagnosis or medications must be entered in your medical record to ensure that providers have a complete picture of your health and that you are receiving the best medical care possible. Finding a provider that you are comfortable with is essential to your health and wellness. VA Mental Health Care Line offers a variety of evidence-based treatments for mental health concerns, including depression, anxiety, PTSD, and others that may affect LGBTQ+ veterans at higher rates than other veterans. We can offer VBC appointments for most treatments, if preferred, and allow you to remain in the comfort of your home. The Mental Health Care Line offers individual therapy, couple, and group treatment for a variety of concerns. The VA also offers hormone treatment, substance use alcohol treatment, tobacco use cessation treatment, treatment and prevention of sexually transmitted infection or PrEP, intimate partner violence reduction and treatment of after effects, heart health treatment, cancer screening, prevention and treatment. Research shows that transgender identity is about 5 times as common among veterans than non-veterans. The Dayton VA understands that veterans with transgender and related identities face increased health risks and unique challenges in health care and is committed to promote a welcoming, respectful environment that is inclusive of veterans. Previously, your medical record had only one place for your sex and gender. Now you can have both your birth sex and your self-identified gender identity in your medical record. All VA facilities are required to provide care to transgender veterans or pay for services in the community. If you need mental health services or other referrals, please ask your provider to place a sexual health consult. You have proudly served in every branch of the military, and we look forward to serving your needs. Where can you find out more information about LGBTQ+ care? Visit the website below. The VA also understands that many LGBTQ+ veterans who remain in the closet do not have adequate social supports and may be more prone to anxiety, severe depression, and suicidal thoughts. If you are in crisis, please call 911-988, call 1-800-273-8255 and press 1 for veterans, or go to the closest emergency room or the VA emergency room. The Dayton VA Homeless Program. The Dayton VA Medical Center prohibits discrimination based on age, race, ethnicity, religion, culture, language, physical or mental disability, social or economic status, sex, sexual orientation, and gender identity or expression. There are no fees for services provided by the Dayton VA Homeless Program. If you are a homeless veteran in need of services from the Dayton VA Homeless Program, please contact 937-268-6511, extension 4235, or extension 1402. In summary, we hope that we have encouraged you to seek out the VA for services and enroll in health care benefits.